want to introduce you to Tina McInnes, physician turned coach. And I can't tell you how excited I am to talk to Tina because we have a lot of commonalities. She really has that foundation of why, fitness, nutrition, sleep, all the basics matter so much, and how ultimately it gets us to the better side. So maybe we could start, Tina, like what's your story, right? Like, because you went from doctor to coach. So walk us through how you end up where you are now.
Sure. I'm very open about my journey and all the personal parts of it too, because I think it speaks to people and it tells them something and maybe even connects them to me in a way that's really important to me now in my work, because you have to know your coach and connect with that person. So I studied medicine at University of Toronto, did my internal medicine residency there, and then finished with a general internal medicine fellowship. I worked at Sunnybrook Hospital as a hospitalist in their emergency department. And shortly thereafter, I got pregnant with my first child. My husband and I, we then had another child very soon after. It was actually a funny story, if I could just digress, but I showed up back at work day one after my initial maternity leave. And I said, I'm going to send my urine to the lab because I have a feeling. And the nurses just like, they came running with the result and they're like, lady, you're not with us for too long. So it was the second one came, and then the third one came, and all this time off. And we, in that time, moved cities, and my husband started working as a radiologist here in Ottawa. At the time, he was training with the Marathon Brooks, like the Brooks Project. So training pretty intensely, working. I was home with these three kids, and honestly, I was disconnected, right? And I suffered a mental health crisis. So I had to rebuild myself mentally first, and then, physically, before I could consider then what I was going to do, sort of what job might I look for in Ottawa. And I remember kind of dabbling early on in medicine and seeing if I could do something similar to what I was doing in Toronto. Nothing really quite appealed. It was either all in or all out. And I thought, I can't balance life with that right now anyways, right? So I kept working on myself, and I raised my kids, and I became quite fit, and people started noticing the physical transformation and said to me, what are you doing? And I said, well, I'm just, working out really consistently in a way that I've hardly ever done in my life. And it was in part to kind of help me heal mentally, of course. But it was not with any specific purpose. It was just that. It was getting myself healthy again. And I started sleeping better, and I started eating better. And then the more people asked me about this, the more I sort of said, well, maybe I'll share this passion with others. And I became a fitness instructor and led group fitness, lots of energy. People loved it. We had so much fun. It was dance fitness. It was high intensity stuff, all kinds of things. And then it kind of graduated away from that towards strength training. And I became a certified personal trainer through the Canadian Society for Exercise Physiology. I went to work at a gym, a premium performance fitness center, where my personal coach and head coach there is now my mentor in strength and conditioning. So he's taught me tons and tons over the last 3 years. Dave Fontaine, an incredible person. And so I developed this expertise. And, during all this time, I kept thinking, am I ever going back? But then it just kept evolving. So I started giving people strength training programs and fitness programs and realizing, they do it for a time, and it doesn't really stick. What's missing? Okay, well, the nutrition bit's missing. So I became a certified nutrition coach through Precision Nutrition. Great, helping people kind of bring better nutrition to their lives. This complements the outcome, but even that was kind of fleeting results, not really what I wanted. And then I realized people aren't sleeping. So how can they adhere to anything when, and so it sort of just snowballed into this thing where now I'm a coach, and anyone who signs on with me, they never quite realize at the beginning what they're getting themselves into, because the things that we end up delving into go way beyond what they ever imagined they were getting out of a coaching relationship. But it's in magic there, in opening up to one another, figuring out what the real roadblocks are towards achieving better health. And there always are, right? Like, it's never about a program and I don't know what to do. It's the why aren't you doing what you know that you need to be doing? What life obstacles are present that I can help you with? And so then, this became the thing. And I can honestly say that the transformations I've seen among some of my clients has made it completely it's just incredibly worthwhile, very fulfilling. And it kind of made me realize I was helping to prevent people ending up needing the very specialist I used to be. And
Wow.
how great is that? Because honestly, by the time they needed me at Sunnybrook Hospital, they had 30 years worth of damage, metabolic damage, cardiovascular damage. And from what? Lifestyle disease. And if I could prevent that, what an impact I could make.
Wow. I mean, Tina, this is what the power is in this. This is why was so excited to throw down. Like, listen to this, people. She was doing the frontline work, seeing people at their most vulnerable, sickest, in hospital, needing to be admitted to hospital because of their ailments. But now tying it and realizing, man, if I could intervene earlier, and I could look at and what I also like what you're saying, Tina, too, is like root cause. Like, what are the barriers that are preventing you from getting healthy? Because a lot of it is, like what's going on psychologically or emotionally, but getting down to that root cause and being there for people to prevent them from landing in Sunnybrook or in emergency department. And I got to tell you, on a personal level, this has been a big motivator for me, for me doing content like this. When you see people land in your ICU of all ages, I mean, pre-COVID, but mostly I was pushed through COVID, seeing that they had, lifestyle disease, as you mentioned, their diabetes, their hypertension, their obesity, and knowing that we could do something about it. And really trying to intervene earlier. So I really love the journey, Tina. I really love what you're all about. I'm wondering if you could speak to, because I didn't think we were going to go there, but I think it's worth mentioning, like, what are some of the barriers that you do find amongst your clients? Because I could count, I know so many people, they're like, I've tried this diet, I've tried fasting, I've tried high intensity interval training, all this stuff. It's not working for me. And as you said, sometimes you got to get to the root. What's the barrier? So what kind of themes have you noticed as being barriers for improvement?
I think the number one thing is that people initiate interventions that are too much of a dramatic departure from the status quo. And they want to leap into fitness or health where they need to walk. You need to, frankly, you need to crawl before you can walk, before you can run. And it's trying to skip steps in that journey that often leads people to fail time and again. Right? And it's tempting to want to say, okay, January 1st or whatever, first sunny day, whatever. We see peaks, right, in our consultations, and they're predictable. And it's when people finally say, okay, that's it now. That can't be the approach. You have to be ready to make a lifestyle change. And what does that mean? It means making subtle habit adjustments, one at a time. And it takes a long time to fix a habit, something that's become ingrained in your behavior by virtue of repetition and your own coping styles, for example. There's something that you've learned throughout your whole life. It's not going to be a quick fix. So stopping looking for the quick fix is probably the first thing. I try and educate people to buy in, if you will, to my concept of change, which is habit-based.